So I'm doing another blog, and it's actually somewhat close to my last blog, which is a little bit exciting. So let me tell you about my last few days. This is unbelievably crazy. So Tuesday night, okay, I started on, I think I said this in my last blog, I started on this new medicine through the hone in my chest, or the catheter in my chest. So I was on this, and every Tuesday I had a nurse that came over, and she would draw my blood and do lab work and everything else on it, and take my vitals and all this good stuff, all because of this staph infection and blah blah blah. So Tuesday, a nurse came over, did the whole deal. I ended up going to see the doctor because I started like breaking out on my chest, which I don't break out on my chest. She thought it was a rash, so I went and saw the doctor. Doctor started taking cultures of it and everything. It's been insane. Straight up insane. He started doing cultures. I went down to the lab. They drew all kinds of blood from me, started doing all kinds of cultures. Tuesday, when I went in, I kind of had, my temperature was like 99.1, which is usually normal because I'm hot-blooded. Hey ladies, I'm hot-blooded. Jump on that. I'm sitting there, got all this stuff done to me, and went home. I was feeling kind of crappy. Then Tuesday night, I started feeling kind of bad. I started getting really, really cold. I went and sat down in my bedroom and just sat on the air vent on the floor and had my heat cranked all the way to the top. I just sat there with a cover and I was just shaking, so cold. So I took my temperature and I had a 101 fever. I'm like, damn it. So I called my doctor. This is like 8 o'clock at night. Call my doctor on call. And he's like, well, you know, why don't you go ahead and go down to the emergency room, have them check you out, everything else. I'm like, okay. So I go to the emergency room. They get me in the back quickly. I sat there for about an hour and a half, did not see one person. Sitting in the back. Finally, people started coming in. They started taking x-rays of my chest, everything else. They started drawing blood and put it in a catheter, which was really weird because they put a catheter in the bend of my arm, which I've never had a catheter in the bend of my arm. So that was like really uncomfortable. I wasn't real cool with that. My doctor tells me to tell the people at the hospital that there is files on me in the computer from when I went to the doctor earlier on Tuesday and got the blood done and everything else. The nurses went out, came back in, said that there was nothing in the computer. I'm like, you've got to be kidding. So they call my doctor. My doctor's like, well, I need him at my hospital, which is like 20 miles away. So an ambulance comes, picks me up, takes me by ambulance to this other hospital. I'm not going to say the name of the hospital because you're going to find out my experience at this other hospital. Go to this other hospital, they admit me. They come in, hooked me up, or did like vitals on me and everything. It was crazy. When I went to the hospital, they took my it's kind of an important piece of information. They took my temperature and it was 103.7 when I had gotten to the hospital. So over the extent of maybe a half hour, it went from 101 to 103.7. So I mean, it was a pretty large increase over such a short time. So immediately what everybody thought was something had gotten into my hone, which is the catheter in my chest. Something had got in there and started just attacking it. So they did blood work, everything else at this new hospital that I'm at now. A nurse comes in, takes my vitals, and I'm feeling a little bit better because I was like nodding on and off throughout this whole process, and so I was like sleeping, and I think I was sweating a lot while I was sleeping, so I think I sweated out some of the fever. So I'm there. While I'm there, like, I don't like hospitals. I have spent probably 60% of my life in a hospital, and I don't like them. I get kind of like an anxiety when I'm in a hospital room. My mom is there with me, and she's there for maybe an hour when I first got admitted because I've never been to this hospital before, so I don't know what files they have on me, nothing. So I'm in this hospital, and my mom says something, because I'm still nodding in and out of sleep. My mom says to them, you know, can you give him something to help him sleep and to help his anxiety tonight? And the nurse is like, oh yeah, sure, you know, that's no problem. And so my mom's like, great, you know, they're gonna bring it in, everything else. So my mom gets ready, she leaves. The nurse comes back in. I ask her, hey, can you give me something for my anxiety to help me sleep? Okay, sure, let me go grab it. I'll be right back. So everything's fine. She leaves. A couple hours later, this is about 2 in the morning, maybe an hour and a half, 2 hours later, she comes back. I'm like, hey, do you think, she asked me what medicines I'm on. I tell her my medicines. I said, I have not taken any of my medicines, but I need to take my medicines before I go to sleep. Which is very crucial that I take this medicine before I go to bed every day. She's like, okay. I never got my medicine. She never brought me anything for my anxiety or to help me sleep. Nothing. But then later, I'm gonna kind of jump back and forth. Later, right? But my mom had asked her why she didn't give me the medicines, and she said that she came in to give them to me, but I had declined them. No, I don't think so. So everything, I'm dozing in and out throughout the night on Tuesday night, dozing in and out asleep. The next day comes, and I was there for just about 24 hours. They took my vitals twice. Once when I got there, and once Wednesday morning. They took it about 8 o'clock Wednesday morning. I went through the entire day Wednesday, not having a clue whether or not I had a fever, what they were doing. They had me hooked up to this medicine that I'm getting now. It's actually an IV drip. And they had me hooked up to that every 8 hours. So it was really, in between these 8 hours, this medicine would take maybe a half hour to come through. In between these 8 hours, I was hooked up to nothing. So I was just sitting there doing nothing, and it wasn't quite clicking in my head why I had to stay in this hospital when I could just be hooking up this IV to my home, and I could just leave, go home, and do this myself, because these people weren't doing anything. They weren't taking my vitals, they weren't watching over me, nothing. Every person that came into my room was more concerned about why I had a cast on my foot than why I'm exploding with a fever. And so that was just outrageous. Another nurse came in, and I had went out occasionally and just went for a walk because I was starting to get just cooped up in there, and I can't stand just laying there and watching the 4 channels that they have on TV. And so I'm out for a walk. A lady comes in and starts talking to my mom, and the nurse is like, well, when's the last time he had his cast changed? What the hell does it matter? I mean, I'm not there because of my foot. Like, I understand that the staph infection that is still currently in my body is a concern. I get that. But it has nothing to do with my leg anymore. The staph infection is no longer directly in my foot like it was. It is in my system. Get off of it. So they were very much concerned about why my foot was in a cast, how I broke my foot. I continuously had to tell them I didn't break my foot, I had surgery on it, I had reconstructive surgery, and they fused my ankle, they put me in a cage. This cage is the one that created the staph infection in my bone. The staph infection started going through my system. This is why I have the hone in my chest, and this is why I'm getting medications, and now the hone is infected, so this is why I am now currently breaking out into a fever. So let's get our minds off of the cast and off of my foot and bring it up to my head, because this is where it's burning. Wednesday, I asked my mom to end up staying for a little while because the things that are happening throughout my time there are getting more and more ridiculous. I am nodding in and out of sleep, and I'm starting to become a little bit afraid of what they're going to do if I fall asleep, what they're going to come in and do. Why I am afraid of this, I am getting ready to explain. When this on-call doctor, this house doctor, not my original doctor, I love my doctor, but this house doctor came in, had no clue what hemophilia was or how to treat it. Really? You're a doctor? What? She's in there, she's asking me all kinds of questions, which is fine. I've never been to this hospital. You're supposed to ask all kinds of questions. You're supposed to get familiar with, I'm doing a lot of these today. You're supposed to get familiar with your patient and get to know their medical history. That's fine. I'm answering all these questions. You know, I tell her that I'm a hemophiliac. She's like, well, what does that consist of? What is that? I'm like, okay, well, I bleed internally into joints, everything else. She's like, well, when's the last time you had medicine for this? Do you take it orally? I'm like, no, I have to infuse myself. Well, how do you infuse yourself? I have to stick a needle into my arm, pump in this clotting factor. Fine. That all goes on. A little bit later, a nurse comes in. This is where my mind clicks. Fast forward a little bit, I end up discharging myself on Wednesday night about 9 o'clock or so. This is the reason why. A nurse comes in probably around 2 o'clock, 3 o'clock in the afternoon on Wednesday, and she hands me a piece of paper and she goes, this is the medicine that I'm going to be giving you. I'm like, okay. And she goes, so I'm going to be right back. I'm going to be sticking a needle in your stomach to give you some anti-coagulant medicine. What? Really? The doctor had ordered the nurse to come into my room, stick a needle into a hemophiliac's stomach, and give him medicine to make sure that his blood doesn't clot. Make sure a hemophiliac's blood doesn't clot. Me and my mom immediately jump on this nurse, not like physically, but we're like, I looked at the nurse, I go, no, you're not doing that. And she goes, well, that's the orders from the doctor. I go, what doctor? She goes, well, the on-call doctor, or the house doctor, the on-staff doctor. I said, well, you don't do that. You can go tell that doctor that this isn't going to happen. You're not going to stick a needle into my stomach. She's like, well, we have to do that. I don't care what you have to do. I'm telling you, you're not doing it. And so me and my mom are like arguing with this nurse. So finally I'm like, you do not stick a needle into a hemophiliac's stomach. That's going to immediately start a bleeding episode into the stomach. A bleed in the stomach is incredibly difficult to control and to get rid of. Just because when you are bleeding into a joint or something, you have to keep it immobilized. So you can't be moving it, anything like that. And I've had bleeds in my stomach and in my chest. And those two things are the most difficult bleeds to get rid of. Just because when you're breathing, your chest is moving up and down, and you're continuously opening up the bleed again and again and again each time you breathe. So it is very, very difficult to control a bleed in the abdomen or any part of your midsection. It's very difficult to control. And same with the stomach, just because you're always having your stomach acid moving around and your stomach's always moving and everything. It's just difficult to get under control. So the nurse almost seems offended that I have declined this treatment. She leaves. So I never see another doctor except for that once when the idiot doctor came in and had no clue what I was talking about. I was there, like I said, for almost 24 hours. I got 1 cup of water. I had to actually, I had 2 nurses that I saw them maybe once or twice during their shifts while I was there. I had to call them in if I needed something. That wasn't really okay because they were never in there to kind of check on me and to see, to take my temperature, nothing. The only time that they came in there was to hook up the IV for this new medicine, this new IV antibiotic that I was now getting. So about 8 o'clock, my mom's sitting like next to me because at this time I told my mom, look, I don't want you to leave because if I fall asleep, I am terrified of what they're going to come in and do. because if I was just thinking about what would have happened if I was asleep. And when I'm asleep and, you know, you wake me up, I'm really groggy and I'm not real coherent on what's happening, anything like that. If I was actually asleep when this nurse had came in, she had stuck that needle in my stomach, I would have owned this hospital. Owned it. That would have been a massive malpractice suit. There would be no way. So about 8 o'clock, I looked over at my mom and I said, you know what, I'm done. Because I'm not sleeping here tonight. So I have to call in the nurse. And they were like, yes, can I help you? And I'm like, I need to talk to somebody in here. They're like, okay, we'll have somebody in there. So nurse comes in. She's like, you wanted to see me? Yeah, I need you to go get some my discharge papers. I'm leaving. She's like, what? What? You can't leave. Like, I'm sorry? I'm 27 years old. I have a right to discharge myself and leave. Because at this time, when they had taken my vitals, my temperature was down to 99, and I was feeling totally fine. Like I had said, while I was sleeping, I had sweated a bunch of this stuff out, and I was doing a lot better. And I'm still doing great. Like that night when I got home, I had absolutely no fever. I was feeling awesome, and so whatever got into my home hit me hard, and I think it just like went crazy in my system. My body got rid of it quickly. I tell this nurse, I'm sorry, like I'm going kind of back and forth. There's just like so much stuff that happened this night, and I want to try and get it all in. But so this nurse is sitting there and she's arguing with me because I'm asking her for papers. Finally, she's like, okay, I'll be right back. She leaves. 5 minutes, 10 minutes later, she comes back. And she goes, okay, well, we just tried to contact your doctor, which I had been trying to get a hold of him all day, but he was in meetings, which is totally understandable. I get that. But I wanted to know what was happening, what was going on, because my cultures were supposed to come back at 12 o'clock noon that day, and I never heard anything about it. So I don't know what had happened with the cultures, what was going on. I had no information that was passed on to me throughout the entire day. No clue. So the nurse comes back. She goes, well, we just tried to get a hold of your doctor. We paged him. So if you could just stick around for a while longer and wait for him to call back. I said, no. I would like you to go get my papers, bring them to me so I can sign them so I can leave. She goes, okay, but you can't leave. You're on antibiotics and you can't leave. I said, I don't think you're really grasping what I'm telling you. I'm leaving. Either you give me papers for me to discharge myself, or I'm going to take the IV out of my arm and I'm walking out. It's your decision. Either way, I'm leaving. And most of you know I'm a very hard-headed person. When I make up my mind or if I make a decision, I'm sticking to that. It's not a whole lot, especially when I am this adamant about my decision, because I do not feel comfortable staying in this hospital another night, because I do not know what they are going to do with the orders from this house doctor. She's like, okay. So she leaves, comes back again with the phone. She goes, I have your doctor on the phone. I go, my physician? She goes, no, the house doctor. I go, I don't care. I don't care. I don't want to talk to your house doctor. This is the doctor that ordered me to have a anticoagulant and a needle stuck into my stomach. She doesn't know how to treat me. She goes, well, she wants to talk to you. So I take the phone and I'm like, hello. She's like, I'm understanding that you're wanting to leave, blah, blah, blah. And I said, yeah. And she goes, well, you can't leave because you're on a antibiotic right now, IV drip, and you need to stay here. So if you want, you can stay until the morning, and then your primary doctor can come and see, and then we can switch it all over to an oral antibiotic. What? The whole reason I have a hone in my chest, a catheter in my chest, this thing in my chest is so I'm not on this oral antibiotic. This thing is here because it gets this medicine for the staph infection into my system immediately. Pills and oral antibiotics, they take some time to get into your system. This is here for this particular infection. So this doctor is like, you know, you need to stay there until the morning so your primary doctor can come in and talk to you, everything. I said, okay, you know what? This is how it's going to happen. I'm going to leave tonight. I will call my primary doctor tomorrow morning, and I will get in there, and I will see him, and he can do whatever he wants, prescribe me on whatever he wants. Fine. So, so this doctor, oh, and by the way, she's like, well, I'm not in the hospital right now. But I remember seeing your chart, and you can't leave. It's like, well, you're not in the hospital right now. So, and I hear her kids like laughing in the background and everything, like, you know, giggling and everything. So I'm assuming that she's at home or somewhere. And so that kind of irritated me that they couldn't get a hold of a doctor that was actually in the hospital that could physically come and talk to me. Because I think I had like 3 different doctors throughout the 24 hours I was there. The main doctor that was on my little board, I never saw once. So I'm telling this doctor I'm not staying, and she's sitting there and she's arguing with me over the phone, everything else. She was a different nationality, so it was kind of difficult to understand a lot of the things she was saying, and she continuously interrupted me, which was driving me crazy because I had started trying to explain a little bit of what was happening there, and that I wasn't comfortable staying the night because I wasn't comfortable of what they were going to do while I was sleeping. And she kept cutting me off and saying, well, that's not how everything has happened. And she's like pretty much calling me a liar, which was pissing me off. Finally, then she tells me that my primary doctor is assisting her. So she's the one that's calling the shots, and that she is the one that is ordering everything. And so I say, so you're the one that had ordered the needle to be stuck into my stomach. And she's like, yeah, well, yes, because every patient has to have an anticoagulant so they don't accumulate blood clots. I said, you know I'm a hemophiliac, you don't do that. And she's like, well, yes, I misunderstood that. Well, you could have probably just maybe have killed me by doing that. I might be like exaggerating, but it would have been painful and I would have been pissed. Finally, I had enough of talking to her. She's still talking. I hand the phone back to the nurse. I said, I'm done. Take it. So the nurse walks out, comes back in, and she's like, we got a hold of your main doctor, and he said that he doesn't want you to leave, that he wants you to stay. I said, you know, I respect and I love my main doctor, my primary doctor, but I'm not staying in the hospital. I'm not staying somewhere I don't feel comfortable staying. I said, so please, for the 6th time, go get my discharge papers. She's like, okay, I'll be right back. And so she finally comes back with a piece of paper, and she has me sign a blank piece of paper. Really? You didn't fill anything out on this paper, and you're just having me sign this blank piece of paper. So finally I'm like, you know, I need you to put the doctor's names on here. I need you to put what time you talk to them. I need you to put, I'm telling this nurse what she needs to put on this discharge paper. And so she fills that out. I tell her I need a copy of that. I get a copy, and after 45 minutes of asking her the first time, I am finally leaving. Real quick, let me back up. When I first got there, she had put in a second catheter into my arm. She had put the tourniquet on, and this tourniquet was on my arm for 15 minutes while she sat there and went like this. And then she decided to pull out the needle, open up the alcohol swab, prep all of her supplies. My arm is turning blue. I'm losing feeling in my arm. My fingertips are tingling. Can't really feel too much anymore. 15 minutes. 15 minutes. Finally, she sticks the catheter into my arm. She stuck that needle into my arm so slow. I am real good about getting shots, but that hurt because she stuck it in, missed the vein, so she had to fish around. And for those of you that have been to a hospital and that have had a catheter, those are pretty large needles because the needle pulls out and then it's left, then that little tube is left in your arm, that little bendable tube. So, I mean, it's a large needle. So she's fishing around in my arm looking for the vein, and still, catheter, the tourniquet, still on. Finally, she finds the vein, pulls the needle out, and leaves the tube in, puts all the stuff down, and everything, and it's done. So I have now I have a catheter here and a catheter here. And so I finally say, you know, are you going to take the second catheter out? Because I don't need two in the same arm. She's like, oh yeah, okay. Takes that catheter out. So that was a few of the things that happened during my stay at this hospital. Would I go back there? Absolutely. No, I will never ever go back there. I could be dying, and I would rather be placed in the hands of some homeless bum than go to that hospital because they had no clue what they were doing. But so I finally got out of there around 8:45, 9 o'clock, and I had called my doctor the next morning, and I talked to his nurse, and I said, hi, you know, this is Andrew. She's like, are you the one that discharged last night? I said, yeah, that was me. And she started laughing a little bit, and I hear my doctor in the background. He goes, well, we still love you. And I was like, I appreciate that. So I was telling my nurse a little bit of what happened. She's like, well, write it all down and fax it to me. So I did that, and then my doctor faxed it all over to the nursing staff at the hospital. So I'm actually going to be writing a letter to the medical board of Missouri, and I'm going to send them the letter. But yeah, this is far from done, because everything that happened there was very unbelievable. Like, it was hell. I absolutely think that my decision to leave was 110% right. So I'm really happy I got out of there. And I would never ever go back there. Nope. So now I'm on this IV drip. I'm on this new IV drip that takes about an hour and a half to go through. I have one of the IV poles, and so it hooks up to my home, and I have to do that, which I'm perfectly fine with, and I didn't see a need to stay in the hospital in order to do that, since I can do it here at home. So that was my experience over the last few days. Oh, and my dog has separation anxiety. My chocolate lab, Hannah, has, when I got into the hospital, my dogs went over to my parents' house, and Hannah was throwing up everywhere, and she was so upset. And so my parents took her to the vet because they didn't know what was going on, and the vet told them, because the vet, you know, knows me, and she's like, you know, well, where's your son? And my parents were like, well, you know, he's in the hospital, he got admitted and everything. And the vet told them that some dogs, they have like really bad anxiety when their master isn't around or isn't with them. And so Hannah has separation anxiety when I'm not there. So that's my baby. That's my little girl. I missed her a lot. I miss both of my girls a lot. But Chloe's a lot more independent, and Hannah is very much a daddy's girl. So yeah, anyways, I know I'm running on quite a bit of time right now, so I'm gonna go. But I just wanted to kind of share all that because it was pretty extreme. Anyways, I'll be back on soon. I am feeling a lot better, so I'll be able to kind of start doing vlogs, you know, closer together and everything. So everybody, you guys have a great night. And to all my subscribers, you know, I love you guys. You guys are great. To everybody that's new watching, thank you so much. I appreciate it. And that's about my time. So, God bless, guys. I love you, and have a great night, and I will talk to and see all of you soon. All right?